This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now, affecting emergency physicians and your patients. I'm Laura Wooster. In response to significant pressure by ACEP, chapters, and lawmakers, Anthem has announced changes to their emergency department denials program, which applies to all 6 affected states: Georgia, Missouri, Kentucky, Indiana, New Hampshire, and Ohio. However, even with these changes, Anthem's policy to deny coverage for emergency care still leaves patients at risk. ACEP released a statement that these changes are not nearly enough, and we still call on Anthem to get rid of the policy altogether. Senator Claire McCaskill of Missouri, who sent Anthem a letter in December asking for all of their internal documents leading to the policy's creation, also issued a statement saying Anthem's response isn't going to cut it, and called on Anthem once again to share the documents, which the company has yet to provide. ACEP's campaign to preserve the prudent layperson standard and call out Anthem Blue Cross Blue Shield for denying coverage for emergency care continues to generate media coverage in all the states where Anthem is active, and in news organizations such as the LA Times, Vox, Associated Press, and Modern Healthcare. ACEP's video campaign about Anthem so far has generated more than 340,000 views. For more information, go to faircoverage.org. Anthem is not the only insurance company facing scrutiny about denying emergency care. Congressman Ben Ray Lujan of New Mexico last week sent a letter to the CEO of United Healthcare asking about that company's denials of emergency visit coverage if they determined the visit was non-emergent after the fact. Congressman Lujan says this raises serious concerns that United Health's actions could have the dangerous consequence of depriving patients of needed care or discouraging patients from seeking treatment for emergent conditions. On Tuesday, a bipartisan group of 8 senators introduced the CARA 2.0 Act of 2018 as a follow-up to the original Comprehensive Addiction and Recovery Act of 2016. In addition to detailing how some of the $6 billion recently appropriated by Congress should be spent, it also has several new policies regarding opioid misuse and prescribing. This proposal will be the baseline for congressional discussions in the Senate, but we fully expect it to receive significant modifications along the way. While the bill includes many positive provisions, such as expanding access to medication-assisted treatment and establishing a national infrastructure for recovery support services, there are several areas of concern for ACEP. In particular, the proposal would strictly limit opioid prescribing for acute pain to only 3 days, with no exceptions for clinical judgment or medical necessity. We will be working closely with lawmakers in both Senate and the House to modify CARA 2.0 to ensure it improves patient care and access to opioid misuse treatment services without inappropriately hindering evidence-based clinical decision-making. Stay tuned for further details. On Monday, the House of Representatives approved the ACEP-supported Mission Zero Act. The bill would establish grants to civilian trauma centers to enable military trauma care providers and trauma teams to provide care in those facilities and provide opportunities for them to practice skills and coordination prior to deployment and to maintain them after returning home from service. This improves military readiness while providing additional trauma resources to the public. As well, ACEP continues to develop its legislative requests for the reauthorization of the Pandemic and All Hazards Preparedness Act, in preparation for action by the Senate Health Committee and the House Energy and Commerce Committee. We have already met with several key lawmakers about this legislation and have participated in multiple meetings with the current Assistant Secretary of Preparedness and Response, Dr. Robert Kadlec. The committees hope to have this legislation prepared by the end of March. That's ACEP's Capital Minute for the last week of February 2018. Thanks for joining us. I'm Laura Wooster.